Good evening. Now, cervical cancer has become very topical around the world. Now, if you're a woman or if you're a man connected to a woman, you should be concerned about cervical cancer. Now, tonight on the show, we are discussing this all important topic, and we are looking at issues like what causes it, symptoms, treatments, and any other questions that you might send in, or any other contribution that you might send in. My name is Ama Pratt, and you are watching The Couch. Now, for a discussion like this, we need an expert, and that's exactly what we did. And so to discuss this topic, I have with me Dr. Caryn Agyeman Prempeh, and she's going to be doing this discussion with me. Please stay tuned.
Dr. Caryn Agyeman Prempeh, medical doctor, based in Accra, is currently one of the young yet bright medical doctors at Claron Medical Center. She is the founder and chairwoman of CERVICAL, an NGO based in Ghana, West Africa, with focus on educating women on cervical cancer and raising awareness. This has been her focus for the past 5 years, focusing on educating small group of young women in ensuring a better understanding of preventative measures and steps to take when encountered with any stage of cervical cancer. She was trained at Akufo-Addo Teaching Hospital, located in Kumasi, Ghana. She is a proud Roscan with an amazing heart. Cervical cancer occurs when abnormal cells on the cervix camera grow out of control. The cervix is the lower part of the uterus that opens into the vagina. Cervical cancer can often be successfully treated when it's found earlier. It is usually found at a very early stage through a pap test. Most cervical cancer is caused by a virus called human papillomavirus, or HPV. You can get HPV by having sexual contact with someone who has it. There are many types of HPV virus. Not all types of HPV cause cervical cancer. Some of them cause genital wart, but other types may not cause any symptoms. Most adults have been infected with HPV at the same time. An infection may go away on its own, but sometimes it can cause genital wart or lead to cervical cancer. That is why it is important for women to have regular pap tests. A pap test can find changes in cervical cells before they turn into cancer. If you treat the cells changes, you may prevent cervical cancer. Symptoms of cervical cancer may include bleeding from the vagina that is not normal, such as bleeding between menstrual periods, after sex, or after menopause, pain in the lower belly or pelvis, pain during sex, vaginal discharge that isn't normal. If you are the age of 26 or younger, you can get the HPV vaccine, which protects against types of HPV that cause most cases of cervical cancer. The virus that causes cervical cancer is spread throughout sexual contact. The best way to avoid getting a sexual transmitted infection is to not have sex. If you do have sex, practice safer sex, such as using condoms and limiting the number of sex partners you have.
Welcome back from that, viewers. Now, if you are like me, those images were rather disturbing, if not unexpected. Now, when I introduced the doctor, I said Dr. Caryn Agyeman Prempeh. I forgot a little detail, the fact that she's my doctor. And so sometimes if you hear me call her Ohima, please pardon me. That's how I call her. Doc, welcome to the couch.
Thank you, Amma.
Why do you have an interest in cervical cancer? You see, I just switched the questions up a little bit.
Oh dear. This is something that I came across while I was in medical school, 5th year. I'm sure people in medical school will know that in 5th year we do obs and gynae and then pedics. That's pediatrics. Now, on the part where we went into the consulting room, I noticed that women that came in to see the doctors in Konfanochi Teaching Hospital who were diagnosed of cervical cancer were always in the terminal stages. I didn't understand what was going on, so I kept asking questions. I asked my professors why, and because I did a bit of my schooling in England, and I know that in England the NHS is always on your neck for you to come and do your pap smear.
Get a screen.
Yes.
Every now and then they send you a letter.
And there's letters coming in. If you don't come, they will call you.
Yeah.
And so I didn't understand why in our part of the world it's different. Because with pap smears, they won't get there. But these women came in terminal stages, and then they're told that, okay, you're going to die, but we're going to try and do chemo. We're going to try and help you. And so it's not a definite, yes, you're going to be cured. And that got me thinking that, okay, maybe I can look into the reason why this is happening in this part of the world. Now I have another part of the same 5th year where we do our public health research. We always take a topic. And then along the lines when everyone was picking up their topics, I just said, why not cervical cancer? Why not understand why? I want to know. Why in our part of the world? Is it that because, yes, it's bad socioeconomical status that is making us not able to educate people? What is it? I want to understand. So I went all the way to Battle, stayed there.
Where?
It's in the Volta region.
Okay.
So imagine I'm from Kumasi, packed up all my stuff because I read that one Dr. Ifa was so interested in it. So I wanted to go to that hospital and sort of understand what's going on. So I went through the village in the area, spoke to them about it. And to my surprise, a lot of people did not even know what cervical cancer was. To them, it was some weird thing that happened to you when you've been cursed, when some people will travel to maybe Abidjan or Togo or for a better living in Nigeria and come back and they're not well, they're shrinking, they're dying. And people would also say that it's HIV. No. Some people will say, oh, they're there, their wives have some offensive discharge coming out. It means they've been cursed. Lack of a better words, they say that rivalry, because your husband's second wife or first wife has cursed you, so you can't stay with your partner. And it was sad. Just the fact that I know from another part of the world that just a pap smear would be able to pick up an early stage of it, even before it becomes malignant. A pre-malignant stage can be picked by a smear test. It's very easy. And I went further to read that there were people who were trying to also do a cheaper version of screening where you can visualize it. But that won't tell you whether it's a pre-malignant. It will tell you there's a change. And that's why I'm going to go into the whole topic of cervical cancer, tell you what it is, risk factors, preventative measures, how to know when cervical cancer comes.
It's a question. Now, this conversation is very important. Yeah. And I love the fact that we are having it in a not in a not
medical
setup. Yes, because let's be frank and let's call what exactly it is. Most of us anything cancer, you never think about it being about you or somebody that you know. It's always so remote, isn't it? Ohima, what is cervical cancer? What is it?
Okay. When you ask me that question, I want to divide cervical cancer. Cancer is a division of cells, abnormal division, because the body itself, as we went, some of us in school, we learned sciences, mitosis, cell division, growth, and all that. Now, there's an abnormal version of it. Abnormal, like it's not supposed to be there, but it's there, and it's just erratic. It divides, and it's also getting the same blood supply that the good cells are getting. They're getting it, and they become a tissue, and then they are growing. That's cancer itself, which can affect anywhere of the body, which we all know. Now, what's the cervix? The cervix is the gateway to the womb, as the medical term uterus. You can find the cervix when you look at the structure that came up. there's the vaginal canal, then there's a little part about, a narrow bit that enters into the into the uterus, sorry. And the uterus is the womb, commonly known. Now, this cancer affects that part of the uterus. So it's the opening of the uterus. And this cancer just affects, it's a cancer of the opening of the uterus. Basically, that's it. It's that simple.
What are the symptoms? How would I know that I have this?
Okay. Now, most people do not find any signs or symptoms until they start feeling that severe abdominal pain in their 40s, in their 50s, in older women, where they tell you that I can feel this very bad smell, discharge. Not the normal, ones we have after our period, because after our period we do have like a bad smelling discharge, which shouldn't last because it's just after your period. That's normal. But these are older women, probably in menopausal or premenopausal, having bad offensive discharge with sometimes bleeding, abnormal bleeding. Sometimes after having sex they're bleeding for no reason. After some women douche, when you say douching, they push stuff up there, and then there's abnormal bleeding. These are all abnormal vaginal bleeding. You need to go and ask a doctor about it, really, because it's not the normal menstrual cycle. We all know that women go through our monthly shedding of the endometrium, where there's bleeding for about 2, 3 to 7 days. Some people, it's a range. Everyone has a different cycle, and this is regular. Every month it comes. But when you notice that there's an erratic vaginal bleeding, which you don't understand, you don't feel well, there's abdominal pain. These are actually signs and symptoms, early signs, basically. When we go deeper into it, when you're affected by this cancer, that's what we call a metastatic symptoms as well. Sorry, let me put it right. When I say metastatic, it means that the cancer has migrated from the cervix, has affected probably your liver, your lungs, your kidney. And that's when you see people lose weight. They look wasted.
Oh, I would want us to talk about the stages, but I want to know when it starts, because most of the times you're not very in tune with our own bodies. You're not very aware of ourselves when I say that. Some of us don't lose track of even a regular,
menstrual cycle. Yes.
So, are there any early signs that can prompt you, so that you would be a little more alert to your body?
Okay. Just like I said earlier, for instance, it's common in these signs would let someone in their 40s worry a bit. Hardly do you see it. Do women in their 30s complain about these? Like I said earlier on, apart from your menstrual cycle, you have an irregular menstrual bleed, and you're thinking, okay, I just had a bleed. I had sex with my partner. I'm bleeding. What is it? You don't understand. You would want to let your gynae have a look at it. I'm sure most Ghanaian people will come to a general practitioner instead of going to the gynae.
Yes.
And then the gynae would look into it, ask you questions. That's when they get the history of the offensive vaginal discharge, where you know that it's not the normal one that, as I said earlier on, after your period you get it, or possibly a sexually transmitted disease or something. There's this offensive, foul-smelling discharge that you see that is not normal. Some people will tell you that after having sex with my partner, I bleed. No, you're not supposed to. No matter what style your partner or your husband is putting you through. For Christ's sake, you shouldn't be profusely bleeding. No. So it's the fact that the cervix has become a bit, let's for lack of better words, injured. Because there's cell changes. There's something called dysplasia. The cells that are supposed to divide, the normal cervical tissue cells, have been affected. So now there's a disease cells being divided over there. So a little contact would cause bleeding.
It's like a normal sore.
Yes, something of that sort.
Injury.
But there's a growth on it. And when I go into explain the etiology behind it, then you understand why it affects that part of the body.
So let's go there. What causes it?
All right. I always say that the risk factors for cervical cancer is difficult to discuss in our part of the world because in our books it tells you that promiscuity should be prevented.
Promiscuity?
I know. They tell us that we should stick to a single partner. And when you stick to a single partner, it means your partners should stick to a single partner too. So monogamy. How on earth do we discuss that in our part of the world?
Hold that thought now. US, I think that over the weeks, all the topics we've been discussing, you know, be it politics, be it social, now be it medical, there's always a social cultural element to the discussion. Well, grab a bottle of water. It's going to get wet. Let's have it here. We'll be right back.
Bibiara wa melko Luciano le melko Nofiano ye melko. What are you looking for? Melcom got it all. Big discounts to door. Yamafia so best bodies on our days. Everything here is about game. High quality. Be a priority. Tell your mom, tell Kobe, tell your actually everybody. Bibiara Malcolm.
Bill. Welcome back from that break, viewers. We are talking about cervical cancer, and we are doing that with Dr. Caryn Agyeman Prempeh. We're talking about the causes.
The interesting part of it.
Yeah, and you just surprised me by talking about promiscuity. Now, worse, not just the female's promiscuity, but that of the partner.
Yeah.
Please.
Okay, so the one most common, let me say the most striking causative agent for cervical cancer in women, because obviously it won't affect men, is the human papillomavirus. The human papillomavirus is sexually transmitted. Now, when it affects men, there's good, I mean, lack of better words again, there's good and bad. The good ones are not to say they don't cause anything. They do. They cause genital warts. Some people would have it for the rest of their lives and might never have any problem with it because the immunity would fight it. It will fight this virus. However, some people will come up with genital warts. Now, the high risk ones, that's the ones that I call bad ones, are the ones that will cause the cervical cancer in women. Now, for instance, your husband has a partner who transmits or, gives him human papillomavirus. You're sitting at home. You've done nothing wrong. he comes, you have sexual intercourse. Now you're sitting with the human papillomavirus as well. You have high risk, you have low risk. Which one do you know you have? You don't know. In your 30s, you're having fun with your partner, really. You might end up not marrying the person. Now, you jump onto the next person and you have sex with the person. The person has the human papillomavirus from you and then passes it on. So we are sort of spreading the human papillomavirus. But with women, we end up suffering from the cervical cancer because this virus causes the cell changing that occurs at the cervix. Some people end up with vaginal warts. The men would have the penile warts, which I'm sure I wish I had the picture to project. It's quite scary.
Yeah.
But that's something medically can be dealt with. Yes, it can be dealt with. You know, there's treatments for it, surgically and then medically as well. Now, when you don't get those ones and you get the high risk ones, it's not there and there it tells you that, okay, you have the cervical cancer. No. The virus would cause cell changes over a period of time. So this could have happened in your 20s, in your 30s, but you're going to have the effect in your 40s and your 50s. The person who passed it on to you is probably nowhere to be found. Or if you're still with the same partner, the partner is probably sleeping with other women and bringing something to you. So when they say promiscuity, that's what they mean. Because research has said that nuns have less incidence of cervical cancer. That's not to say that, you know, the only cause of cervical cancer is promiscuity, because there's that risk factor of family history of cancer as well. Your mother could have had cancer, and genetically, it will pass on to you, yes. So just like all other cancers, when there's a family history of cancer, there's a chance of you having it. Just like breast cancer, just like lung cancer, just like even prostate cancer in men. If your father had some sort of a cancer, there's a high risk that you would have some sort of a cancer. So it could be that it would affect the cervix, because it's just a cell division. It's like a gene coding, you know. So that's one that we're dealing with in our part of the world. If we could reduce promiscuity, yes, it would help. It would reduce the incidence of it, because when we had, according to UNICEF, about 4 years ago, 2,000 women that were affected or were diagnosed with cervical cancer, 1,005 out of them died. I mean,
serious business.
That's just bad statistics for our country.
Can you prevent it with prevention? Can you point out?
Yes, and that's why the developing world is not having the same statistics as us. Because guess what? They are educating people about cervical cancer. They're telling them about it. People know what it is, and the gold standard of the screening where the pap smear comes in is very common. Every year you walk into the GP.
I was even talking about condom use, for instance.
Yes, condom is a you know what, on the list of preventative measures, condom use as a barrier is the best way to prevent it. However, we are trying to say that, okay, how many people are going to accept this condom use? Because we're already advocating condom for other sexually transmitted diseases. And are people really sticking to it? No. You encounter men who will tell you that it's better when it's skin on skin, you know. And our women are so socioeconomically deprived that we have no say when your partner wants to have sex with you.
Dependence on the man.
Yes, in our part of the world.
So what he says is law.
Yes, it is, unfortunately. So we always say that, why not get screened as a preventative measure? Why do not, you know, catch it when it's early? Because
here in Ghana, let's even talk about Accra. Let's not go too far. In Accra, now, if you want a pap smear, where do you go?
Okay. From what I've gathered, it costs 30 Ghana cedis in the government hospitals.
30 Ghana cedis?
Yes, 30 Ghana cedis. Obviously, in other part of the world, it's part of the health insurance. Yeah. It's not part of our health insurance, unfortunately. It's not. Now,
but it should be, shouldn't it be?
That is what we're dealing with now. I'm praying that someday, from the education that we're doing, because to reduce the incidence of cervical cancer, we ought to educate people. And I'm happy to have such a beautiful platform like this. And I mean, I'm happy because a lot of young people are listening. And we have to, yes, not to say that the older generation have been affected, so we should let go of them. No, but let's focus on the
young.
Yes, let's focus on the young ones and prevent it whilst we can. So if the young people are aware that, okay, I can walk into a government hospital, but even in a government hospital, they don't make it easy for you to even ask. But I always want to tell people, and I'm happy I'm sitting on this platform, ask a nurse, ask a family planning nurse, ask a gynae, ask any doctor. I mean, bump into anyone and ask. The fear Ghanaian people have, which I've learned over the years of practicing, is that when we're interacting with our doctor, with a medical practitioner, I don't know what it is. It's intimidating. No.
I'll tell you what it is. We want to look. We are concerned about image.
No, but
that's our problem.
You know, the medical practitioner is sitting there for you to ask them questions. You know, I love it when I meet someone who's challenging enough to ask me that, doctor, can you explain exactly what's wrong with me? You know, because I don't want to come and sit there and just scribble, and the person gets up and leave. I want them to ask me questions. But if you don't, I just write something for you and I go, which is wrong. It is part of our job to explain things to people and educate. It's a form of educating people. Because if someone gets malaria and they come to sit in front of you, you do a lab test, you run it, you diagnose them. You somehow need to educate them to prevent it from happening again. Because it looks good medically on the nation when we're able to reduce the incidence of certain diseases. So I'll use cervical cancer as an example. If we're able to educate the young people that, okay, if you are able to go into a hospital and ask for a pap smear yearly, because what I gathered from my stay in Bator was that most women, not only have they never heard about cervical cancer, did not even know what a pap smear is. What is that? And it's just a speculum. Take a little sample, take it to pathology. They see whether you have an abnormal cell or not. There's even a cheaper version of screening. There's the visual, inspection and acetate, where a little acetate is put there, and if there's a cell change, there's some change of color. And that apparently is even cheaper. I'm sure it's, the last time I asked was about 15 cedis.
15 cedis.
Yes.
So first there's a 30 cedis, which at a government hospital.
Yeah.
And then there's a 15 cedis.
In the same government hospital. But these are different types of screening.
Okay.
Now, because there's a queue and there's that discomfort of the government hospitals, the private sectors, I think, charge higher because there's that availability of the person on standby to do it for you. I'm saying that it's expensive, yes.
How much?
I mean, I think different hospitals have different prices, so I can't mention. But I know that when you go to private hospital, there's someone on standby who will do it for you. I will find money and pay and get myself, sorted out. That's not the cure for cervical cancer, but that's the screening, and it helps us. It prevents us from ending up in our 60s or in our 40s with an end-stage cervical cancer where there's nothing anybody can do but palliation. That's it.
Ohima, talk to me about the stages and talk to me about the importance of spotting it early.
Okay.
What are the consequences of not spotting it early?
Okay.
Perhaps stage 3, I don't know what.
Okay. So it will be a very difficult explanation for people to understand because we have stage 1, stage 2, stage 3, stage 4. Even in the stage 1, we have A, B, C because of how the extent of it affecting your body. Now, let me just let you know that from stage 1 to 4, it's severity. So in the terminal stage, it's stage 4. Okay? Yeah. Now, for someone to be caught in the early stage, it helps because you're able to treat it and that the prognosis is better. The earlier you catch this, the better the prognosis is. And so leaving it to the end stage would only leave a medical practitioner saying that, okay, I'm going to keep you a little longer, in life. But, I mean, I'm not certain. A hysterectomy can be done, when the whole uterus has been affected. Because when it starts at the cervix, it's growing. And then the cancer cells are moving. in the pelvic, because that's the nearest area before it affects your lung, before it affects your liver. So treatment modalities that are available are the chemotherapy, the radiotherapy, and the surgical removal of your uterus as a whole. Some people might be lucky enough, they will have a combined, treatment where you can do chemo with surgery, radiotherapy with, chemotherapy. There's, depending on the staging of it. The staging itself is a whole medical a medical checkup itself, because you have to do your x-rays to check whether it's affected your lungs, the ultrasound of the kidneys, and then the liver to check if it's been affected and whatnot. So depending on what stage you've gotten to. But in a nutshell, what we're saying is that the earlier we catch it, the better the prognosis is.
Okay.
Now, let's talk about the screening. I think as much as we're educating women that let's be, aware of this. Let's know that promiscuity would put us as risk. Not using a condom is putting us as risk. Low socioeconomic status is actually one of the factors that put us as risk. Because, you see, when you're a woman and you're sitting at home, you're not working. Whatever your husband says is gospel.
The law.
Yes. That's not to say that you're supposed to, rattle and rant when your husband talks. No. But at least you have a say.
Well, we have a difference in opinion there.
Exactly.
I mean, we sometimes we need to ramble too. Well.
So I always say that when we are able to address these risk factors, it would help us understand, and it will even reduce, I think it will reduce the incidence of this. Smoking in women, which I'm happy, I always say that it's not common in our part of the world.
How about your husband smoking?
That's putting him at risk at prostate cancer, lung cancer.
But it doesn't affect you.
No, it doesn't affect you. Okay. Yes. But I mean, when your husband leaves you, it's quite sad. So you want to tell them not to smoke and all that. I mean, attacking the risk factors, as in educating people about the risk factors, makes me happy, because then you know that by not doing this, we are reducing the incidence of this. And also punching on the fact that let's be screened.
How often should a woman get pap smear?
Okay. The screening is not just anyone. You can't just go around screening a woman who's had a hysterectomy, because then what are you screening? The uterus is not there.
There's nothing there.
And so I always say that in the UK they say from the age of 21, but it doesn't happen anymore, because in our part of the world, not in our part of the world,
everywhere,
the 13-year-old girls having sex. And once you're sexually active, you need to be screened, because it's possible that the human papillomavirus, you've sort of accommodated it.
Oh, wow.
Yes.
So let's talk to the woman who has never been pap smeared, and this has nothing to do with social cultural background.
Okay. So for a woman who's never been screened, or this is your first time of hearing what a pap smear is, let me actually tell you what a pap smear is. It's a gold standard of screening, where you go into the medical practitioner's office. It's just a day, you lay on the bed, and then there's a speculum passed to look at your cervix, inspect it physically, and then a little brush, it's very tiny, is inserted. It's just comforting, but it's not painful. It's inserted at the opening of the cervix, which is the opening of the uterus. So it's inside your vagina and then in the cervix. A little brush is, a little sample is taken, where a secretion, and then it's put on a slide, fixated, and then it's taken to pathology. Now, I'm sure a period of time will be given to you where your report will be brought back to you, because the pathologists need to look at it under the microscope, see whether there's cell changes, whether there's whether something is happening or not. Then your report is given back to you. When your report is given back to you and it says that no abnormal cell changes, I always say that it's not to say you should stop. I think you should check every year.
Every year.
If you can.
If you can, check every year.
Every year. Make it an appointment, you know.
That's if you're a sexually active woman.
Yes, you should.
Check every year.
Yes.
How about
the nuns?
Yeah.
Well, I wouldn't ask a nun to check for cervical cancer. However, there's a family history. If there's a positive family history of cancer or cervical cancer, I would say that, you know,
still check.
I mean, it doesn't kill.
Still check.
Yes. But the world is moving forward. We're forgetting about one thing. There's vaccination coming up.
Great.
It's even in the system, but it's quite expensive. I don't know the price, but I remember that the former First Lady of our country tried something in the Ghana Dangbe, tried to vaccinate a group of girls, even though there were issues about it. But this is something that has worked in South Africa, where schoolgirls of the age of 9, 13, you know, ranging 9 to 13, have been vaccinated, because the vaccine. This is one thing about the vaccine. The vaccine does not work if you've been exposed to the human papillomavirus, because you're being vaccinated.
A little too late.
Yes. So
too late.
That's where the problem is. So we have to catch them very young.
Very young.
And today, when you walk to a woman and say your 9-year-old daughter needs to be vaccinated, she says, "Why? Who told you she's sleeping with a man?" But we're not there in schools with them. We're not there. Even in our secondary schools, we're not there. And today, 9-year-old girls are getting their period. So I would advocate for, if we can.
The earlier the better.
Yes, the earlier the better.
Before they even start, the earlier the better.
But I mean, our mothers are still skeptical about it, because they feel like then you are agreeing. It's like accepting to give your husband a condom when he's going on a trip, right? It's like, okay, you're telling him that yes, you're going to have sex, so this is a protective. Yeah. But yes, I mean, he will not come home with STIs if he uses them.
But you're quite controversial, you know that. You're quite controversial. I want to take us, you know, back to the treatment. What's the point of the treatment? Is it to eliminate the cancer?
Yes.
Is it to make you feel better? Or both?
It depends on what stage of the cancer you are at. In the first stages of the cancer, where it's affecting just the cervix, you know, that's to the chemotherapy. It's chemical therapy to kill the cancer cells. But before you kill these cancer cells, you need to, as I said, metastatic staging. You need to know that it hasn't affected certain part of the body, and so you are attacking this part. There's different drugs for this. Some people will tell you that then, if that's the case, I'm just going to take out my uterus and have peace.
Especially if it's an older woman, isn't it?
Exactly.
A woman in her 40s,
she doesn't need.
But
don't forget that some people who leave their husbands, because divorce incidence is very high these days. Yeah, it's very common.
True.
So when you get to 45 and you've met your limo somewhere,
your soulmate,
and the person wants to
have what we're talking about before.
Exactly. You know, when you want to have a pension child and then you know your uterus is out of the way, then what do? But I know that in the developed world, when people have finished having their children, they opt for their uterus to be taken out. Because your vagina is there. I mean, if you want to have sex, it is there. It's just because your uterus is sitting there waiting to have a baby in it. But if I'm not going to use my uterus to have a baby, what am I carrying it for? Yes, it's out. It even prevents you from uterine, endometrial,
UTI.
even endometrial cancers. It prevents it. You know, the uterine fibroids that are worrying our mothers, our black generation. I mean, how today we still have to tell women that uterine fibroids affect black women and Asians, and then everyone is looking at you like, why? Is that fair? And I'm like, well, we still don't understand it. So I'm not advocating that every woman go out there and take out your uterus and throw it away. No. But at a certain point in life, when you look at your age, you're like, what am I really doing with this? Let me just take it out, because you don't know what your husband has been up to. And you don't want, at the end of the day, we're dealing with fear of breast cancer, and then we're crying about cervical cancer, and then we're going to cry about uterine cancer. You know what? I take it out and have my peace. And the little time I have left, enjoy.
Oh, it's not easy being a woman, is it?
I know. But I'm sure the men are also saying that it's not easy being a man.
It's not easy.
Because Charlie, you work hard, they have to take some girl out and spend the money on her. It's not easy like that.
I'd rather spend money than be sick or him. I'd rather spend money.
But they also have their issues. I mean, they have the prostate cancer sitting there where they feel the world has come to an end, basically.
Okay, I don't know why I'm staying on treatment, but because it's important, isn't it?
Yes.
Are there any side effects?
Well, just like all cancers, the chemotherapy has the loss of hair and all that.
Well, in this era of wigs,
Exactly. I mean, wigs is another. I think we need to have a session about wigs on the show.
I know.
It's saving a lot. But the men are saying that when you take it off, it's a bit scary. Because your wife is looking all beautiful and then they yank it off and it's like, okay, who is this?
Who is this?
I know. I'm sure one day a child will start screaming. They're like, I'm looking for my mother. Yes, the chemotherapy comes with its side effects.
So there's a loss of hair.
Yes, the loss of hair, the loss of weight, But once you beat the cancer, you're able to recover back to normal. So you look at the positive side and fight. Just like, we see people fight breast cancer and all that. People have fought cervical cancer and they've won. So it's not to say that the ones that didn't know about it are a lost case. No, I know that people have fought it and come. It's just that when you don't catch it early enough, then
there's a problem.
We're just doing palliative care till you die, because really and truly it's affected too many parts of your body. It's probably affected your ovaries, your liver, your lungs and whatnot, and then it's difficult to fight it. But I know we have good oncology department in the country, especially I know in Komfanochi that we have a good one there. I'm sure in Kolebu they do have it as well. So we're not doing so bad. It's just that, we're dealing with the burden of the breast cancer and then now this. So why not advocate for it to be reduced, its incidence to be reduced if we can? I mean, this is very easy. Telling girls that this is out there, so be careful. The shame about it is that people do not know it's there. And I sat and realized that it's because people found out about breast cancer. Now incidence of breast cancer is reducing. Cervical cancer is the second most common cancer that kills women.
What's the first? Breast cancer.
It's breast cancer now. I'm sure new researches will come out and we will know that
cancer will probably overtake breast cancer now.
Because 5% of all cancers are cervical cancer. And look at that. I mean, that's a percentage of women out there. It's a bit unfair. And in the developed world, they're doing much better. The numbers are reducing because of screening, because of education. So in our little way, we need to try and tell girls out there, and even guys, because I'm sure sometimes when guys say things, women listen, What can we say? So telling them about it, making them aware that this thing is there, so do not ignore it. When you're having an affair with a young guy, do advocate for condom use, protection. And that, as we said earlier on, it goes a long way. It prevents a lot of sexually transmitted disease, and you, the girl, you are safe. You're walking the streets.
It's very important.
Exactly.
Think about yourself.
But we don't.
Think about yourself.
I mean, we don't.
Ohima, what would be the implication for pregnancy? Pregnancy is a huge issue for every woman. At a certain age, if you are married, people are asking questions with their eyes.
I know. And then Afisha Pao, Afis is saying, wow. And I'm thinking, okay, are you going to take care of my child? Yes. It's one of those things.
Pregnancy is a huge issue.
Yes,
what's the implication of cervical cancer for pregnancy?
Well, it's if you want to ask if it's compatible with pregnancy, yes, you can get pregnant with an early stage. When I say a pre-malignant stage of cervical cancer, because at that stage it hasn't affected the cervix. However, when it has formed, when these changes have the cell changes has occurred, it's ruined the opening of the uterus. So where is the sperm going to go through to even get to the uterus, for it to even get to the fallopian tube, for it to even meet the egg there? I mean, where is the sperm going to go through? I don't know if you get what I mean. the gateway is blocked. So to get pregnant, it's going to be, I mean, I don't know, unless we're going to do an IVF where we harvest the egg and then when we finish, we put it back in there and hold you like a little precious egg till you are about to deliver, and then we do a cesarean section and take, hypothetically, that's what I'm trying to say. But I'm sure there's been cases where, you know, women have been pregnant with cervical cancer, but it's still a cancer, and you know, just like breast cancer, someone will say, is it compatible with pregnancy? Yes, it is, but it's a tough case, and
it's tough.
It needs a lot of medical attention. So, as I say, the root is that we just have to prevent it through education, through letting people know that, listen, there's something like this there, and let's try and fight it together as women. And when you look at my NGO, I said we are in it together. Let's
We
fight
are.
it together.
We are. We really are in this together. Well, viewers, we are talking about cervical cancer. I have been talking to Dr. Caryn Agyeman Prempeh, who has indeed shown herself worthy of, first of all, being my doctor, and also worthy of the cat.
I love it. It's so colorful.
Come around sometimes, let's just sit in and we will take a quick commercial break at this point. We'll be right back.
Bibiara wa melko Luciano le melko Nofiano ye melko. What are you looking for? Milk on garden soul. Day discounts no door. Yamafia soul. Best bargains on our days. Everything here is a bargain. High quality. Be a priority. Tell your mom, tell Poppy, tell your actually everybody. Bibiara Malcolm.
Bill. Welcome back from that break, viewers. I have seen your messages, so I think it's only fair at this point that we go see your messages. Well, for those of you who don't know, the WhatsApp line is 026 084 6539. I'll take it again, 026 084 6539. Do send in your views and your comments about cervical cancer. Okay, so this one says, hello Ama, can you provide me the number please? I would be grateful. Peter, I just did that. It's like I'm psychic. I almost read your mind, didn't I? Okay. Okay, so this is about Bible verses. Great. Okay, this one says, Sis Ama, I greet you. You look so pretty. Once again, from Mike at Akosombo in the Western region. Well, thank you, Mike. From Akosombo in the Western region. Okay, this one says, okay, this one sends me a song from Ishon, that's great. Okay. This one says, good evening, my mentors. I'm enjoying your program. In fact, my anatomy is improving. But ask lecturer for me. Okay, so I hope I get the pronunciation right. You know there are words you can spell and not pronounce as well. Cystis.
Cystitis.
I think so.
She wants to know about cystitis.
The question is that and cervical cancer, which one is dangerous and can any of them be spread through the body? His name is Abdullah Emmanuel from Nalerigo.
Okay, so cystitis is an inflammation of the bladder. And because, the bladder is anterior to the vaginal canal. Okay, so it's sitting in front. And when there's, we say women hold urine and urination a lot.
Yes.
That's what causes inflammation of the bladder. Because the bladder holds the urine.
Yeah.
And then it comes through the urethra and then you urinate. But when you hold urine for a very long time, it holds the bad parts and then it causes infection of the bladder. Now what we're talking about is the cervix, which is laying right behind the bladder. So for anatomy, we say that the bladder is anterior to the vaginal canal. Now the cervix is inside the vagina. So this is two different things. One is an infection, one is a cancer. And
The question is which one is more dangerous?
which is more dangerous? I would say that the cancer is, yes. I mean, with cystitis, you see the doctor, you do a bit of hydration, drinking a lot of water, antibiotics would clear it out. And then you're fine. You're good to go.
So this water thing is serious, isn't
I
it?
know.
Water thing is
Ama, your water game needs to be up, right?
I need to upgrade.
Yeah.
I need to
But
upgrade.
I'm told you're doing much better.
Very well. And I've been telling my viewers,
Yes.
please drink
water.
Lots of water.
Hydrate.
Well, now you know where that advice is
I
coming
know.
from.
I'm guilty. I mean, hydrate yourself. It makes you look better.
Okay, this one says, I'm enjoying the show. Greetings to you and Ohima. His name is Paddy from Ashaman Cooperative Transport. Well, hi, Paddy.
Hi, Paddy.
Okay, this one says, Amma, you're looking good as always, and I'm in love with the doctor. I want to ask her this question. I had sex with my girlfriend for the first time. She bleeded massively, thinking she was a virgin. I see that to be normal. 3 months' time, we had sex, she bleeded as well. She bleeds anytime we have sex, saying she wasn't wet. Sometimes she tells me her V is still tight. So when I heard the documentary, the lady actually did the voiceover very well and the editing was on point. But I got scared seeing that. Sometimes I see her legs getting swollen, but she normally tells me that it's hereditary. Doctor, I'm scared and I love my girl. She went for checkup and the doctor was like, there's nothing wrong. Thanks. Permit me, don't mention my name.
Okay. All right. To our dear, for better words, should I say?
Because this is the cash, let's call him Mr. C.
Mr. C, yes. Did your girlfriend see a gynae or just a general practitioner? There are different series of tests to be done. You have to advise your partner to go and see a gynae. For the gynae to inspect and the speculum. When I say speculum, there's something you pass to open the vagina up and to have a view of the vaginal wall and the cervix. It gives you a better view of it. So you know whether there's a tear or something going on. Sometimes when you're having sex and it's aggressive, you have a cervical tear. That's not cancerous. Now, because you're sexually active, please advise your partner to have a pap smear so that if there's any cell changes, it will pick it up. The pathologist will be able to tell us that there's that going on. So my advice to you is ask your partner to see a gynae. If not, get a pap smear, and the pap smear should be able to tell you if it's cervical cancer. with the swollen feet, I understand why you are concerned, because it sounds like, yes, someone who has metastasis, and cancer patients do have pedal edemas and whatnot. Yes. So as I said, I would be happy if your partner can have a pap smear, or if not, a visual inspection, if they can do it. But all this can be done in hospitals. So please tell them to pop in and let a medical practitioner know that they want to have a pap smear, or the visual inspection and the acetate, and they should be able to do it for her.
Should be fine.
Yes.
Well, Mr. C, we hope we helped you with that answer. Okay, this one is from Jennifer from Abelempe. Very good topic of discussion. Most girls and boys from age 13 should be vaccinated, and it should be mandatory in schools. This can really help in prevention. Well, thank you, Jennifer.
Thank you, Jennifer. Yes, that's what we're hoping for. But as I said earlier on, most mothers are thinking, why am I vaccinating my 13-year-old child? I'm telling her that she can go and have sex. As I said earlier on, it's like giving your husband condoms when he's going on a trip. So, hey, I agree. I hope the government was able to even say that just like polio, every kid every kid should get vaccinated, and then
we should start a campaign on that.
Yes,
I'm totally up for it.
Please, I'll be happy, because I go to schools to talk to them, and they're so happy.
Drag me along with you.
Please, I will. I'll be so happy. At least I have a celebrity with me, so they'll listen.
Okay, this one says, I used to have this V-trash, and I have been to different hospitals, and it has stopped. I don't feel the pain anymore, but I still see this whitish fluid coming from my V every day, and it starts coming anytime I urinate. So I always use a panty liner. What do I do, doc? She says she's Evelyn from Ho in the Volta region. Now, the same person asks a second question. Can Dr. Caryn give me her contact so that I speak to her one-on-one, please? I need to discuss something so important with her. I think beyond this one that she's asked, there's more to it.
I'm happy to help. I mean, I'm out there to help girls, and that's what I do. So I'm happy whenever. But to answer your question, most vaginal issues are not necessarily infection per se. It's because of our habits, Sometimes we're wearing knickers that, when I say knickers, panties that are nylon, they don't breathe. So, the heat and all that, in our part of it, it's quite humid.
It is hot.
Yeah, it's hot. So you get heated up, and then you get infected, and, you get trash. It's not always bacteria. Fungal infections go on there, and then they give you these discharges. Sometimes girls of a sexual age also think that by washing there, putting some soaps there, and this story you're telling me is a typical case of soap going there and then giving you a reaction, So please, wash there with water, just plain water. My lecturer said to me in school, she says that the vagina is a self-cleaning oven. It cleans itself. So just water. It's because our part of the world, there's heat. That's why we have to keep clean it, because of the sweat that goes on. But soap has no business close to it, because it gives us a lot of problem when we have soaps there. Now, if it's candidiasis, it would itch. It will give you a patch, like a white patch. It will give you a pattern. And there's medication for it, So if you see a doctor, then again, I'm not allowed to give prescription on TV. But if you speak to a doctor,
it has to come to you. You need to examine first.
So I need to examine and look at it, and then we can treat it. It's treatable. It's not the end of the world, But I always say that the hygiene part too is very important, because you keep treating it and it will keep coming back. That's the reason why. Because you're treating something, but you're not changing the habits that is bringing it. So it will keep recurring. But if you change it, you wear cotton panties, and then you breathe, you let it breathe a bit, It's closed, to be quite honest with you. And then also, if you're sexually active, talk to your partner. Check if the person is being clean as well. You don't want them bringing you things even when you're cleaning yourself. Yeah. So I hope that's very...
We have to be very selective.
Yes.
It's important that we are selective. Okay. This one says, hello, Ama. I'm really enjoying your program. Please tell Ohima we're fully behind her in her cervical cancer awareness campaign. Tell Ohima that this is Dr. Agyeman, her brother at 37 Hospital.
Oh, Agyeman. Thank you so much. Hello. Thank you.
Okay. This one says, Ama. Okay, let me see. Hold on. Good evening, Ama. Please tell Doc to open a church for us to pray together because this topic is deep and we men can't process the details of your discussion. His name is Baba. And then this one says, Ama, please ask Dr. Prempeh if she has been vaccinated.
Okay, I'll answer that. Well, I was sexually active before the vaccine came out, so I can't be vaccinated, unfortunately.
Too late.
Too late for me.
Too late. Too late. Okay, but what do you say about what he says about men not processing this information well? Like, you know, over the weekend when you spoke about the men getting vasectomies.
Yes.
And the men were just leaving the room. You know,
It looks like,
there are topics that
I know, it looks like the topics that men don't want to know,
No.
but they're part of it. You know, without them, we can't solve certain issues.
we are in this together.
Yes, that's exactly what I say, and that's the theme of my NGO. If a man doesn't stop being promiscuous, I mean, you're fighting a lost battle, because yes, I mean, the world has changed. I would have said that the men are more promiscuous than the women, but I hold my tongue.
Yeah.
Because it looks like it's
What a man can do,
a woman can do, so we're all in it together. But then again, in our part of the world, as I said, I'm looking at an ideal situation where you're with your husband at home or you're with your partner. When he goes out there, you cannot put a gun to his head and say, don't go and sleep with another woman, because they are, you know, our society allows that. So there's nothing we really can do about it, but to let them understand that yes, this is what is going on out there. So we can be healthy together. I mean, if you have two wives and both of you understand that, you know, this man is sleeping with both of us, so we need to screen ourselves and make sure that we're not frustrating him enough to go out there and go and sleep with other
Bring a
women.
third one.
You know, I mean, I think we can work with it. I mean,
I think the bottom line is yourself as a woman. Take care of yourself.
Take care of yourself. Yes,
It's important.
because you can't force a man. You know, when you
Care about your well-being.
If you try to be rude, girl, the girl's out there. He's going to abandon you and go. Yes, but you have
be
to fight.
selfish.
Yes, you have to take care of yourself. Get screened. Be aware that okay, I need not to say because my husband is being promiscuous, me too, I'm going out there. I mean, you're going to make the whole water muddled up, and then we're going to fight this war.
He'll suffer alone. He doesn't have a service. Okay, so this one says, please, doctor, my wife bleeds and I smell bad odor. What are we going to do? You didn't add a name.
Okay. My dear, I'm happy that you're concerned about your wife. That alone makes the two of us happy. I think Ama is happy that you're really
I'm very happy.
concerned about your wife. Yes, it's not all vaginal discharges or foul-smelling discharges that are cancer signs. However, I would be happy, as you have said it, get her screened. You realize that everything we talk about comes back to us saying that get screened, get screened, get screened. Do a pap smear or a visual inspection. I say visual inspection because people will tell you that, well, I don't have 30 cedis to go and pay for pap smear. Okay, please go for the lesser one.
Even if I have 30 cedis, it's meant for food.
Yes, that's what they say, because you can't always judge or tell someone what to do. You can only advise. So we'll give you options. You can talk to the medical practitioner wherever you go. When you come to me and you tell me your situation, then we can advise you what to do. But as I said, there are options out there. There's the pap smear, which is the gold standard because it will tell you whether there's a cell change or there's not. It catches it early. That's the advantage that the pap smear has. You know, it catches it before it starts. So if it hasn't started, it will tell you. Then you can be vaccinated if you want to. But I always say that once you're sexually active, you never know. You might be exposed to the HPV and then it hasn't affected your cervix yet. So by getting vaccinated, then I don't really advise it.
Okay. So this one says, hi, little sis. You look pretty. Big sis loves you. Keep shining. From your big sis, Nana Jua Agyeman Prempeh.
Oh my God. Thank you to my big sister. Thank you. She's been rooting behind me since I was a kid, so thank you so much. God bless you.
Keep watching. Keep watching. Okay, this one says, wow, this is interesting. I'm really enjoying the program. Please, doctor, is polyp the same as cancer? What's that?
No, polyp is a growth.
Okay.
Polyp is a growth. Okay. That's different.
Okay.
Polyp can be benign. When you say cervical cancer is malignant. It's bad. You know, it's dividing. It's growing. It's catastrophic. When if I should put an English word there
To it.
I'm sure my mother is going to say she's going fancy right there. So
That's a
yes,
fancy enough,
yes,
right?
Yes.
Okay.
Yes. So that's the difference. Yes.
Okay. This one says Caryn Agyeman Prempeh, former short-time Swesconian with question mark. I think the person was knowing if you went to Swesco.
I went to St. Rose's. Yeah.
You went to St. Rose's. Okay. Well, there you go. Okay. This one says, hi, I'm Akosia from La Paz. I want to know if you can recommend any hospital for the screening.
Oh, yes, I can. I mean, I need to start from the government hospitals, then go to the private. You can go to 37. You can go to Kolibu. If you're in Kumasi, you can go to Konfanochi Teaching Hospital. I'm sure other government hospitals are dealing with it, but you need to ask them first. And then the private sector, you can come to my hospital, Caryn
International,
where we have amazing staff who would be happy to have you and treat you special. We tailor things, you know, we tailor our health to individuals. So when you come in, we'll be happy to talk to you. I'm sure other private hospitals too do offer screening as well. Okay. I know diagnostic centers do it as well, but most I would advise that you go to where you can see a doctor first, and then you can have the pap smear done.
Yes. Okay, so this one says, hi, my wife bleeds whenever we have sex. Can there be another cause of bleeding? His name is Joe from Tamale.
Okay, yes, there could be, but as I said, because I'm talking about cervical cancer today, I would go back to my phrase or statement or sentence or whatever I've been saying. Let her get screened.
Screening.
Get her screened.
Always about the screening.
It's always about the screening. But however, she can actually get her vaginal wall and cervix looked at by health personnel. Passing a speculum and looking at what it is will not kill. You know, sometimes it's probably a cervical tear. You know, we had an old woman, I remember when I was in med school, an old lady who was living with her house help, a nail. And this woman kept bleeding. And the children didn't understand because they were outside the country. So this woman
I know where this is going.
I know. Came into the consulting room, and I remember I was a young woman sitting next to my boss, and then the woman said, yes. To speak my tree, I'm sure the people who know me as my Ashanti girl, I had to bring my tree in there. Yes, so maybe your styles are getting a bit, you know, freaky for her. So.
Very stylish.
Yes. So please be gentle, but do get it checked out. You know, because it's not normal for you to bleed after sex, unless you're saying that the person you're having sex without enticing the woman and getting her to lubricate. Maybe you're not. If you're not and she's finding it difficult, get KY gel. I mean, it helps. It works like magic.
Yeah. On that very educative note, I'll ask my next question. Okay, this one says, Ama, can you please ask doctor if she's single? If she is, I am putting in my application. Well, you need to go through me. You see, I'm the door. I take all the applications, I screen them, and then I forward them to Doc. Right, Doc?
Please come to Ama. Ama will talk to you about that.
Yes, do send all the applications to me. Okay, this one says, Doctor, please, do you deal with HIV patients in your hospital?
Oh, wow. I like that. Yes, HIV patients are patients. They're not HIV patients. They're patients. They're living with HIV. So we deal with them. It's a compound situation where, you know, there's a psychosocial part of it. You know, there's a medical part of it. It's a compound. So yes, I deal with them, and I'll be happy to talk to anyone who has it. But I want to tell people that they're not HIV patients. They're people living with HIV.
Okay. This one says, sorry, I didn't get the name of the hospital she works at. Well, viewers, today you are not following the rules. You see, you need to add your name and where you are sending the WhatsApp form so that I can identify you by name. Please do that. So he wants to know the hospital.
The name of the hospital is called Caryn International Center. It's an airport residential area. I think the landmark I can use is close to Kuala Airport, yes, and Junior's End, yes. So it's quite easy to find.
To locate. Okay. This one says, my wife complains of pain during sex, but all attempts to get her to see a doctor has failed. What should I do?
Oh, our wife, don't do that, please. Our wife, it looks like, you know, you're not making the sex fun. Sex is meant to be a fun act. So if you're not enjoying it, your partner is going to feel very bad, and it's in the mind. Even getting a man to enjoy it, you need to enjoy sex as well. It's a two-way thing. So please do see a health personnel. And if you're not telling him what it is that is making you feel the pain, at least you can talk to a neutral person who's a doctor. It's possible that it's secretion. Maybe you're not lubricating well. So when you come, we'll talk about it. Maybe, you know, you can come together as a couple and then we'll talk about it. There's ways, and, you know, there are different ways of enticing your sexual life. I mean, there's so many things to do. You don't have to be so conservative. There's different things going on these days. So please.
You know what I was going to say? I was going to say, on him, I'll be that. Okay, so this one says, please, can you still have sex when you realize you have polyp? Well, the second question you asked, I'm sorry, I can't get it. I've tried to rephrase it as much as I can, but I can't. So if you could just send in again what exactly it is you wanted to ask. But I've managed with the first part.
Okay, yes. With polyps, I would want you to see a health practitioner, because it also has contact bleed as well. When you have sex with polyps, you can bleed. So please do see someone.
Okay, so Joe from Tamale has sent in a follow-up question. He asked the initial question about his wife bleeding and wanted to know if there were other causes for bleeding.
Yes.
He's asked again. He says, hi, can you recommend any antibiotics for this condition?
It's as I said earlier on about someone else's question. I won't prescribe medication on TV. You would have to see. And antibiotics are for infection. They're for bacteria infections. So you need to be sure that what we are treating is a bacterial infection before you just dash out antibiotics out there. And there are different antibiotics for different infection. There are different, you know, organisms which correspond with different antibiotics. So please, I'll be happy again if you get a medical practitioner to look at it. And if it's a he asked the cystitis question, right?
No.
Okay.
No, he asked about the bleeding.
Okay, the bleeding, yes. I'm sure if once they pass a speculum and look at it, and if it's an infection, you would be prescribed the best medication. Let me put it right. It's not always antibiotics. Yeah. That solves our problem.
Yeah, something else. Okay, this one says, doctor, please, I live in Ho. How do I get in touch with you to help me solve my problem? Okay. I can come to your hospital, but I want to meet you and tell you everything. Please, Evelyn is my name.
Okay, Evelyn. I think Ama is going to put my number out there.
If you want me to, of course I would.
And then you can call me. Unfortunately, when I'm consulting, my phone is nowhere near me. Okay. So you'd have to send me a message. I don't know if it can be done later. I don't know, on your WhatsApp. I don't know. I'd have to give you a work number.
Okay.
Okay, because if I give you my private number on
you'll
TV,
have no
it will be quite.
So that's what we'll do. I'll put out the number after the commercial break, and then they can send you messages.
Yes.
Then you would decide who to call back.
Okay.
Based on the message. Because you see, like I said, let's not put the applications through the WhatsApp. The applications come through me.
It comes through Ama, please.
I don't want anybody overlapping.
Yes.
Overlapping.
Ama is going to scream.
Yes, that's my prerogative.
Yes,
That's my post. I don't play with my posts.
No.
This is the post I hold.
You see, when we're secondary school, I say you're post B.
I'm post B. Post B. Well, viewers, this is our last commercial break. You know, Dr. Caryn has been talking about the importance of drinking water, even with cervical cancer. Who would have thought? So please, grab a glass of water. We'll be right back.
Bibiara wa melkom Luciano le melkom Nofiano ye melkom What are you looking for? Melkom got it so great discounts to go Yamafia so best bodies on our days. Everything here is about game. High quality would be a priority. So tell your mom, tell Poppy, tell your actually everybody. Bibiara welcome.
Bill.
Welcome back from the break, viewers. Now, I just got an interesting message. This one says, please, madam, Akosombo is not in the western region, it's in the eastern region. You see, viewers, don't do this to me. When you send the text message, okay, please add the correct location. Even if you're faking it, do me proud and fake it well. Please. Okay, so let me give you Ohime's phone number. Her phone number is 027-159-9714. I'll do that again. It's 027-159-9714. Now the number would also scroll on your screen, so just keep watching this, just in case you didn't hear me. You know, as I mentioned, and just keep watching the screen. Now I see some of your messages. I'll return to your messages in a bit, but I have a few questions to ask Ohima before I come back to the messages. So do keep sending the messages in. Ohima, let's talk about your daily life with cervical cancer. Does it affect you? Are you able to go about your normal duties, like wake up in the morning, do a little bit of exercise, go to work, have a normal life? How bad does cervical cancer affect you?
Okay, just like all other cancers, I think cervical cancer is as devastating as any other cancer, really. It gives you the systemic, general weakness, feeling unwell, always losing weight, loss of appetite, and whatnot. So it will affect your daily being. But if you're getting treated If you're going through chemo or whatnot, yes, you need to face that part as well, where the chemo itself and the cancer itself together is weighing you so down. So it would affect your attendance to work, and this is the part of cancer that affects our social it affects our productivity as well, and it affects the country as a whole. Because if you're a manager of, let's say, minister of, if you're a PA of the Minister of Finance, and you're not coming, and he's stuck not knowing what to do every day, that's affecting our finances, to be quite honest with you. If you're a bank manager, it's affecting us. It's affecting your children, because they can see their mother go through such pain. Your mother is changing every day. She's wasting away, and it's quite sad. Just like we said earlier in the show, when you hear of cancer, we feel it's far. But when you live with someone with cancer, then you know how painful it is. It's like watching someone who is amazing, and then yet you're going to lose the person soon. It's sad. I know someone who lost their mother to cancer and fought everything in this world. I mean, if money could reverse cancer, that person did whatever they could. And today, when they're going through a difficult time, all they say is, I wish my mother was around. And it's sad. I haven't, fortunately for me, had any relative go through such, or maybe I don't know about it, but I'm close to the person, and I know how they feel when they talk about their mother. If it's not to say the mother would have swept away all his problems, but at least the mother's guidance would have gotten him a bit, more confidence, felt better, safer. There's nothing like a mother's arm. So all I'm saying is that it's not easy living with cancer, as in general. Talk less of having a cervical cancer. I mean, if your breast is worrying you, yes, they yank it off.
You just chop it off.
Yes.
Just chop it off.
It's that easy. I mean, I think mastectomy has become a beautiful thing so much that if you're young and you think you find the oncogenes in you, you take your breast off, you can live. But how do you take your uterus out if you've not had a child before? It's quite sad. So, as you said, living with cancer in general is difficult, but living with cervical cancer would be devastating. Because when I see the women on the ward, I mean, the closest I've come to a woman with cervical cancer is medical, through my work and through my travel around, when I meet women with it and I have to talk to them. It's because they're sitting at home and they're considered sick. Oh, Yari, the person is not.
Because indeed they are sick.
They are sick. And they're wasting away every day. Because when cancer gets to your nail, it's going everywhere. It's not stopping. So that's quite tough to deal with.
Yes. It is tough. Well, let me go back to my messages though. This one says, my woman has white and we are treating it. She has not given birth yet, but when we are having sex, I feel she's too opened.
Okay.
And it makes me feel she is cheating on me.
Okay.
What might be the cause of her
opening?
Flappiness. Okay. 2, she regularly gets boils on her butt. This is me rephrasing here. Please help me. I love her so much. I will be glad to have the doctor's number. Please keep my name private, but he tells me what his name is.
Okay. As I said again, I would love for you to see a medical practitioner. The boils is it's funclosis, it's infection, and it's possible that there's some infection going on. Recurrent candidiasis is a common thing, and you need to treat it properly to get rid of it. There's also different ways we have to look at this. It's possible that whatever is causing it, like I said earlier on, maybe her knickers need to be changed.
I like the way you say knickers. It's such a British thing to say, knickers.
Yes, certain habits need to be changed. I won't draw a conclusion if she's cheating or not. I mean, that's a bit harsh to go on a woman. because she's getting candidiasis. I mean, please pardon her on that and develop on your communication skills with her. I'm sure if you have a good communication skills in your relationship, I mean, what's
nothing you can't overcome. No. Well, it's interesting you bring up recurring, because it was one of the questions that I thought about asking, but I never really got to it. Is it possible for this to recur? Let's say you've been on treatment and you've dealt with a cancer. Is it possible for it to come back?
That's cancer. Cancer is mean. Cancer is it's a sensitive topic, So that's why my aim is to prevent it at all. I mean, I wish we could just eliminate it, but it's there, it's with us. So that's why I'm advocating that we are aware it's there and we prevent it from happening.
Okay. This one says, love you millions. You are doing great with this topic. Your tweenie, Mami Sewa.
Oh, yes. You
have a lot of home support
my
on the
darling,
show today.
That's my tweenie.
Okay, this one says, doctor, please, about the bad odor, can I get any antibiotics?
Well, the bad odor, as I said earlier on, I would recommend that you wash as often as you can.
Wash
with
water.
Wash with water, just plain water. No soap, nothing, no concoction, nothing. I'm sure
douching?
No douching. I mean, douching is a risk factor for cervical cancer itself. And also, go see a medical practitioner. You know what? I'm tempted to start dishing out medication and stuff, but it's not ethically right. So I would be happy if you could see a medical practitioner, speak to a medical practitioner about what's happening to you, get examined, and then we can take it from there. I'm sure there's a solution to your problem.
Absolutely. This one says, I'm John from Tamale. I'm a good job. Well, thank you, John, from Tamale. And it's Doc Zohima. Okay, this one says, thank you very much for this opportunity once again. I just want to know that if this program is going to be every Wednesday, because the program is something every household should not be missing. His name is Abdullah Ibn Husky from Nalerigu. Well, Abdullah, thank you. Thank you for your message. Thank you for the encouraging viewers to watch. Well, yes, indeed. This show is on from Tuesday to Friday. So Tuesday, Wednesday, Thursday, Friday. However, the different days have different topics. What we are doing today is heart talk. We are doing cervical cancer. We might not necessarily do a medical topic next week, but trust me when I say this, Wahima will be back. So just keep watching. She will be back with another topic, right?
Yes.
Wahima?
Yes,
Definitely. Okay, this one says, please, I would like to know the normal discharge of the V. Yeah, please, with a polyp. I saw a doctor, but he told me it was small to be removed. I don't actually bleed after sex, but I don't feel comfortable during sex. And I feel pains around my pelvis. But when I saw my doctor, he made me go through a scan, but there was nothing wrong with me.
Okay. I would answer the polyp question regarding, you're trying to correlate it with the pelvic pain. There's so many causes of pelvic pain. It could be a pelvic inflammatory disease or whatnot. That's why the doctor possibly made you do a scan. Sometimes we women are too cautious of what's going on with us. So there's something called a phantom pain, perceived pain that is not there. It's possible that you have a polyp, so you're associating it with something else. These two things, the pelvic pain and the polyp, could be two different things happening, So if a medical practitioner is looked at you properly, examined you properly, and said there's nothing wrong with you, I would believe my colleague doctor and say there's possibly nothing wrong with you.
Well,
but you can seek second opinion if you're still in doubt.
Yes. Absolutely. There's a question about throat cancer. This person wants to know what causes throat cancer. Our time is up, so just briefly, just say something.
I think throat cancer is just like every cancer. Mostly it's common in smokers, people that are, chronic or chimney smokers, let me put it that way. It's an ENT problem. It can affect anyone, but as I said, it's common in smokers. It can be common in anyone who, who has other cancers and the cancer is metastasis to the throat. It can be cancer from the brain to the neck, to the throat, to the liver, to the kidney, as I said earlier on. Cancer is a gene mutating itself, so it's just cells dividing abnormally. So in fact, it can affect any part of the body. Yes.
Okay, this will be the last one. This one says, Ama, good evening. Please tell doctor I will always be at her hospital anytime I fall sick. She's too beautiful, nice, and very educative. Okay, nice and very educative piece tonight. Ama, keep it up. Evans from Kumasi. Is that my favorite Evans from Kumasi? He's always cooling me on how I pronounce names.
That's nice.
Today he only had nice as well. Thank you, Evans. I hope I'm improving. Your tutorials on names of towns and everything. Thank you for watching. Thank you for all the messages that you bring in. Wow. Okay, let me just run through these ones quickly. This one says, your tutorial. I want something like this. One doctor is talking, she says something like, thank you, vasectomy. Can she please explain it further? This one says, I'm enjoying the program. Please tell the doctor I admire her. Is she married? His name is Prince from Kuforidia. This one says, thank you so much, doctor. Wow, I love that. That was what the person said. Thank you so much, doctor.
Thank you too.
Yeah, I love that.
Thank you. About the vasectomy, it's something we were discussing earlier on over the weekend when Ama was around. So
you guys should watch out for something.
Yes, so we're coming up. It's something we're going to bring onto your screen. So it will explain to you what it means, but just a rough, overview of it. It's a nip, sort of a sterilization, process for men to a form of family planning, a form of contraception, where a part of the male reproductive organ where the semen goes through is sort of cut. So the sperm goes through is cut, so you get semen without sperm, so you can't produce children. So that's a way a man can prevent having children. Okay. But we'll delve into it deeper on the other program for you. So please watch out. We'll be on your screen soon.
Thank you.
Thank you too.
It's always a pleasure. Every time.
Thank you to have my patients sitting right in front of me.
Yes, right in front of you. If you have a doctor like this, you just stroll into the hospital, don't you? And you can even pretend you are sick.
Oh dear.
She's absolutely lovely. Thank you. I always enjoy it.
Thank you so much, Ama. Thank you for giving me such a platform to educate the young ones about what we're dealing with. Yeah. And I'm happy to have you on board too.
Yeah, you really educated us today. Thank you. And you need to watch out for her. Well, we are wrapping up the show. We're actually done. But today, I'd like to say a special thank you to my team. Thank you. You guys are great. You are spot on with research. You are spot on with chasing the guests, and I love you. I love you so much. And to you, the viewers too. You guys are great. Keep the messages coming. Keep watching. Keep telling my guests how beautiful they are. I love that. I love when you do that. Thank you so much. Thank you for watching. Like she said, in this case, prevention is everything. Because once you hit cancer, the possibilities are endless. She talked about reoccurring. You could treat it, but it would come back. Your life with cancer, you don't want to go through that. If it's the breast, you can cut it off. But if it's your cervix, what do you do? So we really aim to not get it. That should be the aim. Let's not get it. If you are sexually active, find a hospital close to you. She says it's 30 cities at a government hospital. Get screened. Please, it's important. As women, we take care of everybody and we forget about ourselves. Please be selfish, it's important. This has been our show today. We'll meet again tomorrow. Bye.